And we welcome you back to In Focus, and it is time now for our African Health Network update, and Linord Moudou is here with today's report. Hi, Linord.
Hello, Dimiake. Hello, everyone. Well, World Diabetes Day was celebrated worldwide yesterday by over 200 member associations of the International Diabetes Federation in more than 160 countries and territories. The group also released its latest global and regional diabetes statistics in its 2012 Atlas. The IDF says diabetes is running at record levels worldwide, and half the people estimated to have the disease are, as yet, undiagnosed. The number of people living with diabetes is now 371 million, up from 366 million a year ago. The numbers are expected to reach 552 million by 2030. The Federation says 471 billion US dollars were spent on diabetes in 2012 compared to 465 billion in 2011. And 4 out of 5 people with diabetes live in low and middle income countries. And finally, 81% of people with diabetes in Africa are undiagnosed. The vast majority of people have type 2 disease, which is linked to obesity and lack of exercise. For more discussion on diabetes, we are joined in the studio by Dr. James Hospedales, Senior Advisor on Chronic Diseases with the Pan American Health Organization, PAHO. Dr. Hospedales, welcome to In Focus.
Thank you.
Well, listen, looking at these numbers, we see that there is more money that has been allocated to diabetes from last year to this year, but yet there are more people living with the disease. What do you make of this?
Thank you. Well, more people are living with diabetes as the numbers keep increasing. As you mentioned, there is a type 2 diabetes, which is the majority of cases. That is strongly associated with overweight and obesity and lack of physical activity. There is also type 1 diabetes, which is often in younger people and requires insulin and is associated maybe with infections in childhood. Both types are increasing, but especially type 2. There are now over 1 billion people in the world who are overweight or obese, and that's driving the diabetes up.
So then when you talk about exercise, the need for physical exercise, overweight, it boils down to the lifestyle and nutrition. And what would you say are some of the most important steps that we need to take to make sure that we can prevent this disease?
Good question. There are 2 major steps that need to be taken. One, to prevent people getting the disease in the first place, and the second is to prevent the complications once you have the disease. Diabetes often leads to problems with heart, problems with the kidney and kidney failure, problems with blindness in the eyes, and problems with the legs and amputations. And so it's important to look after yourself if you have diabetes, not to smoke. It's really a bad idea. To try to not gain any more weight, to be physically active. Have your eyes checked every year, have your feet checked every year, control your blood pressure. This is to prevent the complications. Okay. On the other hand, for people, especially if maybe they have a relative with diabetes, it's important to be physically active, try to lose weight, or at least not gain any more weight. I've almost given up on telling people lose weight. I said, just try not to gain any more. Not to gain any more. Not to smoke, have a healthy diet. It's easier said than done, especially with the forces in society that drive us towards low quality food.
Now, when we look at the global map, we said earlier that low and middle income country seems to be more affected, or maybe the rate is increasing. So what is the issue with the countries, for example, in sub-Saharan Africa? Why are the rates increasing there?
The rates are increasing for the reason I mentioned earlier, that overweight and obesity is going up. I'm aware, not all the countries, but I know South Africa, Kenya, Nigeria, these problems are increasing of overweight and associated obesity and other problems, heart disease and cancer. Yes. So Africa has actually a double burden. You have still significant infectious disease issues like HIV and AIDS and malaria, TB. At the same time, these problems of Western problems are emerging of diabetes and heart and cancer.
Now, moving forward, where do you think the emphasis should be with regards to the way the global community is approaching this, resolving this issue?
In the short to medium term, we have to do 2 things. We have to focus strongly on care, preventive care for people who already have the problem to avoid the complications. Those complications are very expensive, both for the family and for society. In the medium to longer term, we must focus strongly on prevention. Unless we turn around the obesity epidemic, diabetes will keep increasing. Okay. And so this is a top priority.
Okay, Dr. Hospedales, thank you so much for joining us.
Pleasure.
And that was Dr. James Hospedales. He's Senior Advisor on Chronic Diseases with the Pan American Health Organization.